For Health Connection Radio and Body Chemistry Associates, I'm your host, nutritional biochemist Jay Foster. More information on our programs at Body Chemistry Associates, give us a call at 1-800-CHEMIST, 1-800-243-6478. Check us out on the web at 1-800-CHEMIST.com. It's our 37th year of service in nutritional biochemistry and applied clinical nutrition at Body Chemistry Associates. 1-800-CHEMIST, 1-800-CHEMIST.com. Well, February is always considered to be designated as Heart Month because of Valentine's Day. And we have 4 new audio blogs, starting with this one on magnesium. We're going to talk about how important that is for the heart. Next week, we'll talk about natural control of cholesterol and triglycerides. And the third week, homocysteine, one that tests that many doctors and cardiologists don't even screen for, and also C-reactive protein. And we'll wrap up the month in the fourth week talking about certain nutrients like fish oil and CoQ10 that are important for the heart, and also how type 2 diabetes and blood sugar imbalances can affect heart disease, how chromium might help that, as well as other trace elements. And so 1-800-CHEMIST for more information. So today we're talking about magnesium. And it is so important for the heart, and it's a major discrepancy about its importance and the lack of testing and lack of attention that doctors and cardiologists give it. If you went to PubMed like I did this morning, you'd find, and that's at pubmed.gov, med.gov, pubmed.gov. They have a search engine there. You type in your search terms. And if you had typed in magnesium and heart, you would have found that there are 4 references or 84 references, or maybe 684 references. No, there's 6,684 references on magnesium and the heart. Now, some of those are about magnesium metal and stents and things like that, but a large percentage are on magnesium supplementation and the testing for magnesium deficiencies. And they go way back, and we've been working with this for at least 37 years. In a journal called Open Heart, last year, 2018, in July, there was an article called Magnesium for the Prevention and Treatment of Cardiovascular Disease. It's in a journal called Open Heart that cardiologists are encouraged to read. Magnesium for the Prevention and Treatment of Cardiovascular Disease. And in there, in the abstract, it says, in industrialized Western countries, a low intake of magnesium often predisposes to a high prevalence of magnesium deficiency, increasing the risk of cardiovascular disease and cardiovascular death. So if you have a magnesium deficiency, your heart may die, cardiovascular death. You may die of a heart attack. Now, often when you look at medications on TV ads, they talk about side effects as death as being one of the side effects. Well, this is if you don't take magnesium, you could die. And they also say that serum magnesium represents less than 1% of the total body magnesium. We do tissue levels of magnesium, hair magnesium, sometimes red blood cell levels of magnesium. But again, they say that when you're low in magnesium, you increase the risk of cardiovascular events and cardiovascular death. And that was in the Open Heart Journal last year. Lots of information on this. Dr. Stephen Sinatra, who is a board-certified cardiologist, one of his early books called Optimum Health, said the consequences of a magnesium deficiency include cardiac arrhythmias or abnormal heart rhythm, atherosclerosis, the buildup of plaque in the arteries, cardiomyopathy, weakness of the heart muscle, coronary vasospasm, chest pain, which is angina, or angina, and heart attack and sudden death, all due to a magnesium deficiency. And there's so much literature. We're talking over 6,000 articles about this. Back in 2014 in Cardiological Reviews, it says that magnesium is involved in several essential processes regulating the heart, cardiovascular function. It's therefore central to the development of several cardiovascular disorders such as, listen to this, high blood pressure or hypertension, atherosclerosis, coronary artery disease, congestive heart failure, and cardiac arrhythmias. So that's a pretty wide range of heart problems that most doctors and cardiologists especially deal with, but they're not taught that magnesium deficiency may be at the heart of the problem, if I can say that. Molecular Cell Biochemistry back in 2002. Abnormal dietary deficiencies of magnesium play important roles in different types of heart disease, such as ischemic heart disease, congestive heart failure, sudden cardiac death, atherosclerosis, a number of cardiac arrhythmias, and ventricular complications and diabetes. Now, I don't know about all the different types of heart disease that a cardiologist will deal with, but that's probably a big variety of them, and they're not taught that magnesium deficiency may be at the play a central role in the development of these different heart problems. And there's one reason, and one reason only, they're not taught this, is because magnesium costs a few pennies compared to billions of dollars that the medications make. And I'm not anti-medicine. There are some cases, for life-saving conditions, you need medicine. But they overlook this important information. In the European Journal of Epidemiology in May of 2016, serum magnesium and the risk of new onset heart failure in men. And they say that serum magnesium was continuously inversely and independently associated with the future risk of heart failure, meaning the lower your level of magnesium, the higher your risk for congestive heart failure. Also in hypertension, they talk about, there's a lot of different factors there. In magnesium research in June of 2010, low magnesium associated with an increased incidence of diabetes, type 2, metabolic syndrome, death rate, mortality rate from coronary artery diseases, and all causes. Magnesium deficiency is related to death from all causes. Magnesium supplementation improves the heart metabolism, inhibits calcium accumulation, which is a big thing, and also protects against heart cell death. It improves vascular tone, vascular resistance, afterload, and cardiac output, reducing cardiac arrhythmias and improving fat metabolism. So that's, again, a big factor here. One more about magnesium deficiency and death. This is written up in the journal called Atherosclerosis in April of 2012. And the authors state that dietary magnesium intake was inversely associated with death from hemorrhagic stroke in men and death from total and ischemic strokes, coronary heart disease, heart failure, and total cardiovascular disease in women. I hope you're starting to get a picture that magnesium plays an important role. And if your doctor, I used to kid about this, but I say if you go to a cardiologist for the first time and he doesn't mention the word magnesium in the first 5 minutes, run the other way. You don't have to do that, but you should find a doctor that knows about the important role magnesium plays in the heart. It's something that we test for in our body chem program and screen for it, everybody that comes through our door. And then we make recommendations for specific amounts based upon their individual test results. So magnesium really helps the energy and the normal function of the human heart, and is way overlooked. Usually a couple of hundred milligrams of magnesium, not oxide, but a chelated magnesium like glycinate, some kind of a chelate works the best. You can start with 100 milligrams before bed and maybe go to 2. The only side effect of magnesium or loose bowels or diarrhea if you get too much. So you can try that. But the best way is to come in for testing so we know exactly what you need. We can do tests anywhere in the world. If you have a physician that'll send it in to us in the state of Florida, we can do it under our physician. So more information on our testing programs, the body chem programs, and specials they have for Heart Month. Give us a call at 1-800-CHEMIST, 1-800-243-6478, on the web, 1-800-CHEMIST.com. This has been nutritional biochemist Jay Foster for Health Connection Radio and Body Chemistry Associates.